we feel very passionate about this work, and indeed we believe it's work that can actually make a difference. And I was interested to hear Dr. Tom Foley speaking this morning, because I would suggest that the work that we share through a lot of Rosie in the next 15 minutes is actually work that will go some way to meeting some of the challenges that he presented to us this morning. Some of the challenges around patient experience by listening. So I hope you'll listen to the presentation holding that thought in your mind. This project is situated within a paediatric context, and it is a large international collaborative project between the University of Ulster and the University of Technology in Sydney. The leads of the project are myself and Professor Wilson, who holds a joint appointment with the University of Technology and the Sydney Children's Hospitals Network. The study has a number of collaborating sites across Europe and a quite significant number across Australia. But our two leading edge sites really are here in Northern Ireland, because the sites in Northern Ireland are the sites who took part in the original work that I will touch on this morning. And the two sites here in Northern Ireland are the Eastern Trust, and Rosie Kelly is the lead in that organisation, and the Belfast Health and Social Care Trust in the Sydney Children's Hospital, and Patricia Coulter here is at the front table, also who is the lead for the work in the Belfast Trust. The work is built on original research that came from within Northern Ireland, led by myself and others. And it was work around developing a set of indicators, key performance indicators, that would be at the heart of nursing and midwifery, and that would articulate the unique contribution of nurses and midwives to the health and care of patients, clients and families. And unfortunately, time doesn't permit me to start going through the process by which we came around to identifying these performance indicators. But suffice to say, it was over quite a number of years, beginning in 2008 and still continuing today. The 8 indicators are on your screen, and we're starting to refer to these indicators as person-centred indicators. They're very different in their orientation, as you can see in the slide. And I'd like to pull out 2 key differences for these indicators. First of all, they are positive in their nature, so they focus on positive aspects of care. And they are at the heart of a positive patient experience. The metrics that we've worked with to date, they're all very well known. So it's like incidence of pressure ulcers, incidence of healthcare-associated infection, falls, etc. Those are the metrics that we have been using for quite some time, and the ones that are published and profiled in the literature. So these KPIs are really quite different. Quite different in orientation, and quite different in their focus. So I've mentioned that we're trying to refer to them as person-centred KPIs, and the reason for that is because they align to the notion of person-centred practice. And I'd like to demonstrate that through using the person-centred practice framework that was developed by myself and Brendan McCormick over a significant period of years. So the 8 KPIs are aligned to attributes of the nurse in relation to patient's confidence in the knowledge and skills of the nurse and midwife, and they're also reflective of a number of person-centred processes. The consistent delivery of nursing and midwifery care against identified need, time spent by nurses and midwives with the patient. Some are focused on working with patients' beliefs and values, such as knowing what's important to the patient and respect the patient's preference and choice. Some are around shared decision-making, patients involved in the decisions made about his or her nursing and midwifery care. And some are around providing holistic care, which is about supporting patients to care for themselves where appropriate, and patients' sense of safety whilst under the care clinician midwife, which is definitely a big component of psychological care. So you can see the KPIs very different in orientation, and very different in the focus. And I want to remind you for a second time purposefully that these KPIs have potential to actually articulate the contribution that we as nurses and midwives can make to patients' lives and families. And I think that's a really important point. So it isn't just about highlighting some of the negative aspects of care, it is actually about privilege in the patient's voice. These KPIs do that. The only way you're going to be able to measure them is by hearing what patients, clients, and families have to say. And with that in mind, we're going to move on to the notion of measuring these KPIs. Because certainly in the early days when we developed these KPIs, there was a healthy skepticism in audiences where these were presented in terms of measurement. So how exactly do you think you might measure those? So we have spent considerable time in terms of testing a measurement framework that allows us to actually produce data that is significant in terms of demonstrating our performance against these KPIs. And the measurement framework isn't just about number crunching, because that isn't how we're going to measure these KPIs, and that's probably where some of the skepticism came from. There probably was the notion that metrics of KPIs equal quantification of numbers. So it was about triangulation using multiple data sources that comprises the measurement framework that sits alongside these KPIs. And it's about obtaining user feedback, patient surveys, and we're all very familiar with that. But it's also using other methods of data collection like patient stories, family stories. We also do a component of observing practice around 2 of the KPIs. We also look at reviewing the patient record against identified goals alongside interviewing our speaking staff. So a very clear measurement framework that overlays those 8 KPIs. And the PIN study really is taking that notion of the KPIs and the measurement framework and testing it further in a very specific context. And that's what the PIN study is about. The Pediatric International Nursing Study is actually about. I'd also like to mention, very appropriately, that we have a relaunch of the patient and client experience standards today. And certainly the measurement framework also influenced, in the early days, the measurement of the patient and client experience standards, drawn directly from this original work. So it's quite timely that we're presenting this work today and showing how we've moved it forward. And indeed, our patient and client experience standards are also being relaunched today, so quite fitting. So in terms of the PINS project, the aim was to explore the usefulness of these KPIs and the related measurement framework in supporting the development of person-centred practice across a range of services provided to sick children. So that was the notion. And I suppose you could say the whole impetus for this work came from a joint passion and interest between Professor Wilson and myself. Both very committed to practice development and person-centred practice, with Val bringing a very long-standing level of expertise in terms of sick children. So in terms of the sites, as I mentioned at the beginning, we have 12 sites. So we have a number of sites across Europe, which you can see in the slide. And we have great engagement, really delighted with the level of commitment that we have. And we have a number of sites across 5 organisations within Australia. One thing I didn't mention at the beginning is we have developed this as a pilot project. I think probably it's the biggest pilot project I've ever been involved in. But the notion of it being a pilot is because we're testing some of this with the view to further in the future, which I mentioned towards the end. In terms of the actual project, we are right in the middle at the moment, but we've got some findings we want to share with you at this stage. So we did do a lot of work around discussing the KPIs and measurement framework and how that fitted within the paediatric setting. So we did a lot of work with that at the outset, and we had 2 workshops. We had a workshop for European sites here in Belfast, and we had a workshop in Australia for Australian sites. We're now in the process of doing 3 cycles of dedicated lecture using KPIs and the measurement framework, which drives some improvement activity, improvement plans, and that's repeated 3 times. Following that, we're going to engage Val and I in a level of evaluation around what the process felt like for these large number of participating sites, with a view to generating more research questions and further development into the future. I'm going to hand over to Rosie, who's going to talk a little bit about her organisation's experience and some of her specific results emerging from it.
My name is Rosie Kelly. I'm Manager for Paediatrics and Neonatology in the South Eastern Trust, and as kind of said, I run boards and I manage boards of pilot sites, which we're very pleased about. So the process that we went through was supposed to take around about 10 weeks. I have slightly longer than that because it took some time to get organised. But the first 6 weeks really was around giving out surveys to the parents to get their views. Weeks 5 and 6 we did some patient and some parent stories because we were very keen to capture the children's experience and the children's views as well as the parents. We then looked at the documentation and what the nurses were reflecting, did the observations practice, and then we had the analysis and feedback from the staff. So I just want to share a couple of the KPIs and the outcomes with you. So one of the ones we looked at was talking to the parents and the children about whether they felt the nurses understood what was important to them. And we were very gratified that on the whole they did feel that we understood what was important to them. But when we looked at the nursing records, we found that it wasn't so well reflected in the documentation, and that gave us one of our key actions. Parents commented as well that they felt they didn't get enough information when they came in around what the arrangements were in the unit, where they could find things, where the canteen was, how they organised the car parking and stuff. So that was important to them, stuff that they needed to know, because most of our parents would be resident of the children as well. We asked them if they felt that the nurses had enough time to give the care that their children needed. And again, they responded very positively to that. When we looked at the observation practice, we were looking at how much time the nurses were actually spending in bed with the patients. And it was about 50%. Now we all know that the nurses aren't with the patients, they are still probably doing things related to patient care. Whilst the parents reflected very, very positively on that, I think sometimes people perceive that if the nurse is right in front of them, they're not doing anything for them. So it's important that we take that on board and we acknowledge that the nurse isn't always in the bay or isn't right on the bedside. And we need to make sure we're explaining to parents what nurses might be doing if they're not there. And finally, we looked at whether the children felt that they were being involved in the decisions that were being made about their care. And we had a really good interview with one of our adolescent patients. And she was very clear that she felt really included in the decision making. And she said, I was an adolescent, and they treated me like I was the person who was going through all of this, and that I was the one who could make the decisions. And she felt that it was giving her a sense of independence, and she really liked that. And I think it's important that we are able to encourage and support and empower our patients, particularly our young patients, to feel that they are involved in the decision making. So from that, we got a couple of actions coming out, and they're not really a surprise. One was around documentation, and one was around communication and information. So the communication and information, when we are designing a new parent booklet, we're just getting that printed at the moment, and we're going to try and incorporate some of the KPIs and stuff so that the parents do know and the children know that we are doing this work, that we want to engage with them, that we want them to be involved in the decision making, and that we are encouraging them to come forward and speak to us about what their feelings are about what's happening to them in the hospital and in the ward. And in the documentation, we have redesigned our nursing assessment documentation, and we were piloting that, but in fact we're now progressing because NIPEC are currently leading a piece of work around a new paediatric nursing assessment document, and we're going to inform that documentation, and we have incorporated all of the KPIs into that, so it will become part of routine practice, that all of the things that we're looking for in the KPIs will be part of the discussion that nurses have with parents and with children on admission. So our experience, not surprisingly, was that getting staff engagement was key, really important to have everybody on board about this. The ward sister and the deputy ward sister were the two people who very kindly volunteered to do the data and that collection and analysis, and they're both here today. And they've done a huge piece of work, but we wanted everybody on the ward to be engaged in giving out the surveys, reminding people about the interviews, and making sure that people understood what the interviews were about. And we're looking to do that more in the next cycle as well, get people more involved in it. It is time consuming, there's no two ways about it. Everybody's very busy, there are lots of things going on, but we were very clear from the start that we wanted our own staff do this because we want this to be embedded into the ward as part of our culture, as part of what we do, and it's not just something the researchers coming in and looking at. So it does take time. We had to learn new skills around data collection and analysis, which was a bit threatening to start with, but we're getting there. The action planning has given us a focus, which is really important. And we want to be publicising the results for the parents and the children, so we're looking at how we best do that so that they can see what we're doing and they can ask us some questions about that. So I'll hand back to Tanya.
So what we're showing you there is a kind of extracts from their own data. So that's their own data that they received from the measurement framework and using the KPIs. Each site obtains, through support from the project team, their own report, which presents all of the KPIs in relation to all of the data. So that's at an individual level, but also what we're able to do from this project is start to identify outcomes across all of the pilot sites, which is probably really exciting bit for everybody engaged in the project. So it is good to know how you're doing. And I have to say that a lot of all of the participating sites have a lot to celebrate. Because remember, these are positively worded KPIs. So not only are you identifying areas of improvement, but you actually do have an opportunity to really celebrate the kind of results that these sites have been achieving, which is really excellent. But what across the site allows us to do is start to benchmark and compare. And this slide shows you an example of two of the KPIs using two of the different data collection methods in one participating organisation. So in one of our organisations there are 6 units, ward areas participating because they loved it so much. They weren't prepared just to put one site forward. They wanted to do all 6 sites and they are managing it and they are staying engaged. So this is the kind of data that they can get within their own, across their own organisation, and you can see for yourself, self-explanatory. But what we've also been able to do now that we've completed cycle 1, everybody has completed cycle 1, and some people are further on in terms of cycle 2 moving into the next step of action planning. But you can see we've done some benchmarking activity across all of the participating sites after cycle 1, and this is the chart review. But again, one thing we will say is that there really are excellent results coming out across the piece. But at least it's another facet that an individual board gets. They start to see how they're doing in relation to other areas. So you might think you're doing really well, and then you see the benchmarking activity and you think, well, we can obviously be doing something even better. So I think that's a real strength of this study. So that kind of gives you a flavour of that. The project is quite novel in a number of respects. Although what I will say is that the KPIs are starting to be used in a number of different ways here regionally. I know that the KPIs have been part of 10,000 voices, but there is something about how we use these at different levels to try and support nursing and midwifery practice. I will say that I mentioned before it was a pilot project, and it is absolutely a pilot project. I think we probably generate a lot more questions to answer. But I always like to quote my colleague, Professor Wilson, who's also in the industry that has done for some years, but is actually Scottish. We were at a conference a few weeks back, and she's trying to really enforce the point that we've done this with no funding. No funding. No funding. And she said, we're doing this on the fumes of an oily brag. And actually we are, but I think it's testament to the engagement of the sites and the interest in the work. Because I'd like to finish where I started. I do believe that this work is moving from some of the rhetoric that we hear. I would say there's messages this morning that we've heard many, many times. And they're messages that none of us in this room, A, don't already know and would disagree with. But this work is somewhere about putting some meat on the bone of the how. So we've got some problems in our system on how and what do we need to do to try and make that better or different or make an impact. And I think this work is small. It's a small drop in the ocean as to how, but at least it is some of the how. So definite engagement across the project. Watch this space. We have got some plans for the future. We're hoping to bring all of the sites together in a workshop in June. Still no funding for that yet, but we're always hopeful. To try and look at the results we're getting from this work and see where we want to go with it next. because we've got a cohort of people who are tremendously engaged in this work. I'm just like to finish by offering you our contacts. So Rosie, myself and Patricia, who's at the front here in the green. So if you want to hear a little bit more about the work, please do tap us on the shoulder, and we're very happy to talk about it. It's very hard to do justice to a massive project in 50 minutes, but I certainly hope you've got the flavor of it. Thank you.